The abdominal cavity has many lymph nodes. These nodes that are beige colored in this animation are mainly located close to vessels that can be identified with ultrasound. In fact, these vessels represent significant anatomical landmarks for locating these nodes. In the dorsal view, we can first see one of the main groups of lymph nodes, the sublumbar nodes, at the caudal end of the aorta and caudal vena cava, at the site of bifurcation of iliac vessels. The medial iliac lymph nodes are the largest and normally visible in most dogs, whereas the hypogastric nodes are more caudal and central and more difficult to identify unless enlarged. This group of nodes drains the ureters, bladder, uterus or prostate, ovaries or testicles, and the pubic and pelvic regions. An examination of these nodes is especially indicated when a tumor is present involving any one of these structures. The other main group of lymph nodes is in the central abdomen, buried in the mesentery and along the mesenteric and jejunal veins. Several of these nodes are big enough to be seen with ultrasound, whereas the smaller ones are more easily identified when enlarged or hypoechoic. The GI content can sometimes hinder the identification of the mesenteric or jejunal lymph nodes. These nodes drain the jejunum, ileum, and pancreas. Finally, in more isolated locations and in variable numbers, other lymph nodes groups can be identified: the colic nodes along the descending colon, the splenic nodes along the splenic vein in the left lobe of the pancreas, the gastric node, the pancreaticoduodenal node along the cranial duodenal flexor, and a group of hepatic nodes along the portal vein. These nodes are an important part of the ultrasound exam, especially for cancer staging. A convex probe is often used to locate the mesenteric lymph nodes. These nodes can be identified placing the probe transverse to the patient, immediately to the right of the umbilicus. Identification of the cranial mesenteric artery and vein, which make a winding path across the abdomen inside this transverse section, enable us to recognize the adjacent nodes. The nodes have an echogenicity and echotexture that are similar to the spleen. These nodes present a fine-grained texture, which contrasts with the surrounding fat that is coarser in echotexture, even though their echogenicity is usually similar. In the longitudinal plane, we can recognize their fusiform shape, even though one extremity is often rounded. The capsule is strongly echogenic, thin, smooth, and well-defined. In terms of thickness, the nodes can reach approximately 3 to 4 mm in cats and up to 8 to 9 in large breed dogs. Remember that they are often more prominent in young dogs. Observe the pulsations of the cranial mesenteric artery that enables us to confirm the presence of the adjacent lymph nodes. A high-frequency linear probe can also be used to optimize image quality because of its higher spatial resolution. With color Doppler, we can also see the mesenteric vessels intimately associated with the jejunal lymph nodes. Observe the fine echotexture of these nodes, as well as the smooth, hyperechoic, and well-defined capsule. In spite of a similar echogenicity to that of the surrounding fat, it's the view of the capsule and the difference in echotexture we use to recognize them. Echogenicity is normally homogeneous, even though a slight hypoechogenicity can sometimes be observed at the edges, especially in young animals. Observe the vascularization at the hilum in this node, which often disappears in malignant nodes. As with the identification of mesenteric lymph nodes, the sublumbar nodes are much more easily identified by first locating the aorta and vena cava and their caudal bifurcation. The bladder, located ventrally, can be used as an acoustic window and is a good starting point when searching for these vessels. Note how the caudal vena cava is flattened due to pressure from the probe, as opposed to the aorta on the left, which is on the right in the transverse image, whose lumen remains circular. Moving the probe caudally but still in the transverse plane, our attention moves to the left and right of these vessels in order to identify the medial iliac lymph nodes, which are generally apparent in normal dogs especially on the right side. In the long axis, observe the oval to fusiform shape of the lymph node, its moderate echogenicity and very fine echo texture. The ventral surface of the spinal column can be seen deeper in the image. In the transverse plane, we can see the anechoic right external iliac artery that is pulsating. It is located slightly medial to the medial iliac lymph node.